almost 10% of the population has diabetes here in the United States. And of that, about a quarter of those folks don't even know they have diabetes yet. So it's a really scary prospect. But really what's going on is a problem within the body that's causing blood sugars to rise higher than they normally should. So typically we eat things that are made of carbohydrates, our breads and potatoes, other types of starches and grains. Those get broken down in the body into sugar that gets out into the bloodstream, and our bodies require insulin to kind of act as a key. And that insulin key allows that sugar to move into the cells of the body and act as a fuel or an energy source for just those normal day-to-day activities that the bodies have to take on. So what really happens in diabetes is some type of dysfunction with that insulin, that key. So like you mentioned, there are two main types, our type 1 diabetes, or you may have heard it referred to as insulin-dependent diabetes. Those folks, they simply don't produce insulin. And that's a very minor amount of those individuals with diabetes. Only about 5% of diabetics do have type 1 diabetes. Much more commonly, we see patients that have type 2 diabetes. And really what the problem is with insulin in these individuals is they either are not producing enough insulin to respond to that sugar in the bloodstream, or their body is not able to appropriately or properly respond to the insulin that is being made. So as a result, that sugar, rather than moving into those cells and providing that energy for the body, it stays in the bloodstream and can kind of wreak some havoc. And even before all of that, individuals can have what's called pre-diabetes. So before they develop a true diagnosis of type 2 diabetes, we can see blood sugar levels start to be higher than normal, but not quite to that point where a diagnosis of diabetes would occur. And that just puts individuals at an increased risk of course, development of full-blown diabetes, but a lot of other disease states and other conditions as well.
How do people know whether they may be at risk for developing diabetes?
So there are a number of things to think about with being at risk. Some factors people can do things about, they can make some changes, and other things we can't really do anything about at all. So some of those factors that unfortunately are kind of out of our control are increasing in age. So individuals that are 45 years of age or older have a higher risk of developing diabetes. Folks that have a family history of diabetes, whether they have a parent or a brother or sister with the disease. Some of the different ethnic populations are at increased risk. So folks that are African American, Hispanic or Latino, some of our American Indians, Asian Americans, Pacific Islanders have that increased risk, as well as women who have had either gestational diabetes, so a particular type of diabetes during a pregnancy, or if they've delivered a baby that's greater than 9 pounds. All of those individuals are at an increased risk, and we can't really do anything about those factors. But the fortunate thing is there are a number of factors that we have some control over. So individuals are at an increased risk of diabetes and prediabetes if they're overweight, if they're physically inactive, as well as if they have some other conditions. So things like high blood pressure or high cholesterol. So all of those, you can do some kind of different activities to help decrease that risk, whether it's losing weight, having a better lifestyle in terms of diet and exercise.
Some people will be hearing this and maybe they know other people who have diabetes. Maybe they've worried that they are at risk, but they might also ask you as a pharmacist, why should I even care about this? Why would this be such a big deal if I wind up actually being diagnosed with diabetes? I can certainly wind up getting treatment and everything would be fine. Why should people be concerned and do what they can to avoid winding up with diabetes?
Yeah, there are a number of medications that are available for diabetes, and certainly that seems like the answer to many individuals. But the scary thing with diabetes is, like I've already mentioned, 25% of individuals that have the condition don't even know it yet. And even those individuals that have diabetes, a lot of damage happens to the body before they truly have symptoms and figure out, hey, I have this condition. So there are a lot of complications that can occur. Individuals have nerve damage that can result as a result of that extra sugar in the bloodstream. Diabetes can lead to problems such as blindness and other eye conditions. It can lead to amputation of limbs, particularly the feet or the up to the ankle or knee. There are problems with the kidneys, causing kidney disease. Also, a lot of cardiovascular or heart problems. So heart disease, stroke, blood pressure, cholesterol, all of those things can be affected by this extra sugar in the bloodstream. So as a result, it's really important to get those blood sugar levels down or even prevent them from rising in the first place.
We're talking about diabetes with Dr. Erin Pauling from Binghamton University's Pharmacy School. This is called Ask the Pharmacist, and even though it's only our second installment of this feature on WNBF, we certainly will open up the phone lines if you have a question specifically about diabetes, which we're focusing on this morning, or perhaps something else for Dr. Pauling. You can call us now at 772-1290. That's area code 607-772-1290. Or if you just have a short question, you could send it to me, Bob at WNBF.com. Ask the Pharmacist this morning on WNBF. People, I think, in a lot of cases, maybe not the majority of cases, but I get a sense people these days are often inclined not to care too much about preventing illness and disease and thinking, well, if I wind up with some sort of problem, well, indeed, I'll just ask my doctor to prescribe something. We're immersed with whether it's broadcast or online or in print, all sorts of ads for various seemingly miracle drugs and miracle cures to treat various ailments. But certainly that's not the preferred way when it comes to public health. The main thing is trying to avoid the need to prescribe medicines to treat a disease or an illness.
Yeah, I think healthcare in general, we're really looking at prevention rather than having to react to something after it's already occurred. And I think that's really a misnomer among pharmacy and pharmacists as well. Pharmacists are there to, with the medications, and that's not the case. As a pharmacist, whenever I can make some type of recommendation that doesn't include a medication or even recommend stopping a medication for a patient, that I consider that a good day. There are a number of what individuals may think of as magic bullets out there in terms of diabetes medications, but I kind of think of it like a lot of other things. So if you're driving along the road, you're going just 5 or 10 miles over the speed limit, and everybody else is as well, but you see a police car, say, up ahead, you're going to slow down. So you have to kind of think about diabetes and some of our other disease states along the same lines. You might be feeling just fine, not having any symptoms. You're just 10 or 20 pounds overweight. You're not getting the physical activity that you should, perhaps, or not eating quite that healthy diet that you learned about from your family or from school, kind of like everybody else is. But you need to kind of think about that police car up ahead, or that disease state, that diabetes that's up ahead, and what can you do to kind of slow down and make that healthy lifestyle right now before you get pulled over.
Ask the Pharmacist on WNBF. Our guest in the studio is Dr. Erin Pauling. Let's take some calls. It's 772-1290. Carol from Johnson City. You're on the air with Dr. Pauling.
Oh, good morning. I love this topic because I have a friend who passed away from he had diabetes for a number of years.
Oh, goodness, I'm sorry to hear that, Carol.
Yes. Well, I just wanted to say and stress how important, like Bob said, get a medication. You have to follow such a strict diet, it isn't even funny. And I don't want it to sound like it's horrible. It's all healthy eating and, regularly. But what I actually wanted to ask about was hypoglycemia, how it's the opposite of diabetes. Mm-hmm. And could it possibly ever lead to like a reversal in your pancreas, I guess?
Yeah.
And you could get diabetes. I'll just hang up and listen, but I would love to hear you say a few words about hypoglycemia and diet that has to be followed very similarly to what diabetics have to do.
Yeah, those are a great number of points that you bring up, Carol. You're exactly right that the pancreas is that organ in the body that is releasing that insulin, or that key that I talked about earlier, that's essential for the sugar in the diet to get into those cells. Hypoglycemia, or what would be referred to as low blood sugars, is certainly a risk of anybody, whether they have diabetes or not, but particular individuals that have diabetes and are being treated with medications, the risk is of the blood sugar dropping down too low. Now, that certainly does not mean that patients should not take their diabetes medications. They should be talking with their pharmacist, their other providers, and often monitoring their blood sugar with a blood glucose monitor or a blood sugar monitor. But it is that risk of dropping the blood sugar down too low. There are a number of symptoms that patients can feel when their blood sugar drops down too low: feeling shaky, sweaty, dizzy, tired, kind of irritable or angry. Others around them may notice those symptoms, and it's something that does need to be treated, but not over-treated as well. So diabetes treatment really is kind of that walking that fine line of preventing the blood sugars from being too high, but also preventing the sugars from dropping down too low and getting patients into what can be a little bit of a scary or a sticky situation.
Appreciate the question. James from Endwell, you're on the air with Dr. Pauling. You with us, James? Let's check in with Jason. Jason from Binghamton. Good morning. You're on with Erin Pauling.
Hey, Erin. Hey, I just had a couple of questions. I just want to know your opinion on, a few things that people have been using to deal with, type 2 diabetes. As far as what your opinion is of the ketogenic diet and the implementation of fasting. And I also want to know kind of what your opinion is on, how people are saying that Alzheimer's is, considered to be, in some sources, like type 3 diabetes.
Yeah, so you bring up a great number of points, Jason. A lot of areas where there's a bunch of emerging research or ongoing research. When you talk about the ketogenic diet, that's really cutting out all of those carbohydrates from the diet, and individuals then consuming a diet that's very high in fat. In terms of the benefits or perhaps risks of that associated with diabetes, there's not a whole lot of information or research out there at this point in time. So there's not a lot of evidence to say, yes, it can be very helpful or perhaps harmful. What I will say about that is carbohydrates are necessary in the diet. Often, particularly in the United States, we eat way too many carbohydrates, but they are the main fuel source for our body cells. The body cells can get energy and fuel from other sources like fat, so the high-fat ketogenic diet, but there is the risk of having too much fat, causing the production of something called ketones in the body, which can put individuals, particularly those with diabetes, in a very emergent type of situation, something called diabetic ketoacidosis, which is really an emergent situation where patients have to be hospitalized because their blood sugars become so high and those ketones start spilling into their urine. The other thing that you mentioned was with the risk of Alzheimer's disease. And again, that has been perhaps associated with quite a number of disease states, including diabetes. But at this point in time, I'm not aware of a whole lot of research or evidence to be able to support or even refute that. So I think it's still kind of an ongoing area of research, and perhaps even something that with the pharmacy school and that health science campus being built in Johnson City, something that we may be able to look into or collaborate with others on.
Okay.
Appreciate your call, Jason. Thank you.
Yep, thank you.
And I think you've provided a lot of information here for people today. I do appreciate the overview. Was there anything else you'd like to add as we wrap up our segment?
Sure. When we talk about what we can do, and this kind of gets back to some of the questions that were asked as well, is really just thinking about that healthy diet. It doesn't mean eliminating all carbohydrates or not having any cake or candy or cookies or sugars. It's really just moderation. So eating a diet that is low in fat, lower in calorie, high in fiber, making sure patients and individuals are getting a good degree of physical activity. So working out, 30 to 60 minutes at least 5 days of the week. Looking to maintain a healthy body weight, not losing a whole bunch of weight, but really just a reduction of 5 to 10 pounds for many individuals can be very, very helpful. I also just really want to briefly talk about a risk calculator or a risk test that individuals can take a look at online if they're interested. It's a free source from the American Diabetes Association. So if you want to visit diabetes.org, there is a link there that will ask, are you at risk? And there are 7 simple questions that individuals can answer to determine if they might be at the risk of developing type 2 diabetes.
and I just popped that up here. You're right. It's easy to find online, and those questions and just going through with sort of that quick self-assessment can probably be very beneficial to many of our listeners. So I thank you for joining us. Actually, Carol is back on the line. Carol, good morning.
Good morning. I heard you.
Oh, actually, you're a different Carol. You're Carolyn Enwell. Hi, Carol. You're on the air with Dr. Erin Pauling. Good morning.
All right.
Good morning.
There's a lot of Carols out there. Yes, I heard her a month ago, and she said something about she'd be glad to talk to groups. I go to the senior center all the while, and I was telling some of the women about it. They said, oh, that would be wonderful. But the one that runs it said it would have to be scheduled through Office of the Aging. And so if she wanted to give them a call, there's people with their questions already for her.
And just to clarify, last month we had Dr. Angela Riley on. We're going to be having various pharmacists on the segment. So, I mean, every so often, I'm sure we'll have repeat visits. But our first installment was with Angela Riley on February 4th.
Well, anybody that would like to talk to a bunch of old people that don't know.
Well, and I'm sure that with the Office for Aging working in collaboration with the School of Pharmacy, that they certainly will be able to arrange some of those interactions, because I do know from speaking with people at the pharmacy school, they're very interested in educating the community, and that's one of the reasons why we now have the collaboration with this segment on the radio. So I appreciate the suggestion.
Okay.
Thanks, Carol.
You know what? One of the main things that we're saying is, why isn't it in English? You know, it used to be that thyroid was thyroid, and now it's levothyroxine and all that, and you don't know what it's for.
Well, that's true. Sometimes unless it's the way things are described are put into the type of language that the layperson understands, sometimes it becomes a little too difficult. So I'm sure that they pharmacists and doctors will do their best to tailor their presentations to their audiences. So, Carol, thank you so much for the suggestion. I appreciate that. And Dr. Pauling, thank you for being with us today. I think the segment's been very useful for our listeners, and certainly we'll look forward to the next installment of Ask the Pharmacy as we rely on some of the talent and expertise from the people at the Binghamton University School of Pharmacy.
That's great. Thank you so much, Bob. I really appreciate the opportunity to come on and speak with everybody this morning.